Canadian lawmakers are considering opening up euthanasia to, quote, mature minors, adding to the surge in assisted deaths over the past 5 years in the country, with some of the most relaxed euthanasia laws in the world. So what kind of message does this send to sick kids fighting the brave fight for life?
Yeah, for more on this is a father who lost his son to cancer, activist and director of Association for Reform Political Action, Mike Schouten. Mike, this is a very interesting one. I first want to open up by saying, we're terribly sorry to hear about your son, and it's a very unfortunate circumstance that you are here, but you are, and we appreciate your insight in speaking out on this. Tell us a little bit about your son before we get started.
Sure. Marcus was our fourth child. He was 17 years old when he developed a sore shoulder, and over the course of several months, it was determined that it wasn't just a sporting injury. We visited our family doctor after an x-ray, and she gave us the news that he indeed had bone cancer. It was called Ewing sarcoma. And it was devastating to our family and to him. But immediately, his entire care team, as well as us as a family, embraced him and said, Marcus, regardless of what God has in plan for you, we're going to love you every day, and we're going to make sure that you live every day to the fullest. He endured 15 months of treatment, and then it was determined that it was no longer possible to cure him. So all of his care moved, instead of for treatment for cure, to treatment for symptoms and quality of life. And we're incredibly thankful to the palliative and hospice facilities here in Canada that treat children very well. This dovetailed with the work that I do. I've been working on the euthanasia policy, that file for ARPA, the Association for Reform Political Action, for the past number of years. And it was as though this experience just enhanced my passion for stopping the slippery slope that Canada is indeed on.
Mike, my heart breaks for you and your family. I'm so sorry. And you mentioned the work that you're doing. Let's talk about this possible relaxation of this law that allows children to be offered euthanasia. Talk to us more about this.
Well, it's even shocking for us in Canada to be going through this lived experience as a nation. I mean, it was only 6 years ago when Canada's lawmakers decided that euthanasia was going to be legal for a very small minority of people who were very near the end of their life and whose death was imminent within a few days. And 6 years later, now we're talking about euthanasia for children. As of March 2023, euthanasia is going to be available for people with mental illness. It's already available for people with disabilities. So it's very tragic because it's sending the message to Canadians who are dealing with physical and mental health challenges that their life actually isn't worth living, and they might want to consider asking a doctor to end it.
Yeah, well, they recently expanded this to people in, quote, discomfort, which is, there was recently the story of the young man who had diabetes and wanted to do it because of that, and he was initially approved. Obviously, it was overturned. But, this is talking about mature minors, okay? You can't get a tattoo until you're 18. You can't join the military. You can't vote. You can't own guns. Well, you can't own many guns in Canada anyway, but you can't do a series of impactful decisions. You can't make those, and those are, not even immediately life-altering, but you might be able to end your own life medically. Does this make any sense?
No, it doesn't make any sense unless your worldview is such that autonomy is the most important thing, and that's the only thing you're fixated on. I think that's what's frustrating about this entire debate. A few weeks ago, my wife and I had opportunity actually to speak to lawmakers and share our testimony with them, imploring them to put the brakes on and just take a moment to reflect as to what's going on here. Because when we were in the hospice with our son Marcus, it would have been devastating to him if the message heard from either us as his parents or his caregivers was that, would you consider medical assistance in dying? It would have said to him, we're giving up on you, Marcus. And it would have not allowed him to live every day to the fullest as he did right to the moment that he passed away.
Yeah, I can't even imagine that and having the discussion with your child like that. So through your activism and presentations to the Committee on MAiD, what do you hope to see from the medical community, maybe changing the access, to euthanasia, especially for these minors, essentially children under the age of 18?
Well, we're really hoping that the Canadian government will listen to Canadians who are really imploring them. There's a public groundswell growing of Canadians who are concerned about the rapid expansion to euthanasia in our country. We're becoming quite frankly, an embarrassment in the international community when we can't provide proper care for people to the point where, like you mentioned, pain medication for diabetes, sometimes even housing arrangements cannot be put in place to the point where someone feels so despaired that they're going to request a doctor to end their life. So we're really hoping that the Canadian government will revisit this and slow down this expansion.
Yeah, Mike Schouten, thank you so much for sharing your story. Keep doing what you're doing and keep us posted.
Thank you.
Thank you for being here.
Thank you.